Hi, my name is Chuck Officer. I'm Vice President of Innovation at United Health Group. At United Health Group, we have 80,000 people every day showing up, trying to help people live healthier lives. A big part of that is looking at what's right and what's wrong with healthcare. Healthcare is not sustainable today, so we're out trying to do everything that we can do to try to make it better.
Okay. The first question is, do you think people are able to access the medical care they need? If not, how can the system be improved?
No, they can't. And probably better than that is it depends. In fact, the single biggest determinant of your health care is your zip code, is where you live. So we know this by looking at studies and by looking at the analytics and the data that's actually behind that. And that means if you live in one part of the country, you have one level of health care. If you live in another part, you have another. Obviously, getting access to as many people is part of the solution, but that's only a small part of it. If you have rural areas where you don't have providers, doctors and hospitals, then you still have that challenge. We can use, and we are using technology. We spend about a little over $1 billion a year on technology to figure out new ways to improve healthcare and to extend access. So that's one piece of it, is extending the access using things such as telehealth to try to get it out to other folks. But it's a very complicated problem to solve, and there's no one answer to it. There are a number of variables that we would have to try to do, improve to be able to get access to everybody. The recent law they call reform, the Patient Health Affordability Act, the Patient Protection and Affordable Care Act of 2010, sometimes called Obamacare or reform. One of the main goals of that is to improve the access to it, to get it out to more folks than that. It doesn't really address the other side of it, the cost side of it.
Okay. The second question is, do you think the lifestyle of people nowadays has contributed negatively or positively to their health? How so?
Negatively, and we know that. We have strong data that using, for example, obesity and the prevalence of obesity leading to diabetes. We invest a lot of money looking at what can we do about diabetes and how can we change that. If we continue on the trends that we are on right now, by the year 2020, 20 cents of every dollar spent on health care can be attributed to obesity. So we clearly know it's one of the prime drivers of healthcare costs, and it triggers things like diabetes and related diseases, and it's one of the key things that we have to focus on if we're going to materially change or improve healthcare.
Okay. Third, do you think there is a shortage of doctors?
Yes, and having there's particularly a shortage of primary care doctors, of the initial doctors that you go in and see, and they're different specialties. It varies, but in general, we know we're going to have a shortage. We know with reform, with the new upcoming law, that there's going to be a significant increase of people with access to Medicaid, which is our low-income program. And that's going to bring even more people in and fewer providers. We also have the baby boom aging right now. So Medicare, the government program for retirees, also is surging in the population. So kind of across the board from one side to another, there's a significant shortage. And right now only about less than 10% of the doctors coming out of medical schools will go into primary care because it doesn't pay as well as becoming a specialist and going into specialty. So it's a real significant problem, and we have to look at it, and we're thinking of different and innovative ways of trying to address that. For example, one of the things that we can do about that is not everybody necessarily needs to go to the MD. We could triage and basically channel people to the right level of care and not have them over-purchase. There will be more use of physician's assistants, which we're seeing right now, more use of RNs, of RN PhDs, and probably, we assume over time, we're going to have many, many more categories of healthcare providers. The key is to get the person to the right and the most efficient provider for that specific condition, and then when you need more specialty or more care, then you move up or you get referred up to that level.
Is there a shortage of hospitals?
I don't know the answer to that. I think it depends on where you are. So if you're in any of the big western states, they're very rural, and the population can't necessarily, support as many hospitals. So if you are the person in a western state or say northern Minnesota up in Warroad where you don't have a hospital near you, then in Europe, from your point of view, there's a shortage. Other areas, there may be too many hospitals, or there may not be the population to support them. So I'm not certain on the numbers and the statistics around the hospitals, but I think it has more to do with we have a phrase, all healthcare is local, and so it's very different. Our health plans are set up differently across the country, and it really just depends. And kind of goes back to what we said originally, the biggest determinant of your health is your zip code.
Okay. Fourth, do you think that some of the top diseases that cause death, like heart disease or even diabetes, can be prevented?
Yes, we know that. We have the data, we have the studies, and we can prove that. In fact, that's why we're putting so much of our emphasis on preventable diseases. So heart disease, high blood pressure, hypertension. By focusing on those diseases, there are about the top 5 diseases make up, I believe, 75% of the cost. Top 5 chronic diseases make up about 75 cents out of every dollar spent on health care. So we need to attack and go after those diseases and work on them. Diabetes is the other really good example. I believe if we continue on the trends that we are on, 52%, by the year 2020, 52% of Americans will either have diabetes or be pre-diabetic. So if you think about that and think about the costs associated with that and the complications, we have to get out ahead of it. And we have found that programs do work. Disease management programs will look at people with diabetes, create programs, intervene, call them up, have more contacts, have more follow-up, provide more education materials, and we know by studying those that that has an impact. And the more intensive the intervention, the better the results we get with that. So there is a lot more of an emphasis now on disease management type programs, getting involved with that because we have to do that to get ahead of these diseases. Simply, we can't spend fast enough to offset what people will do if they act on their own. People can have behaviors like lack of exercise or overeating that it's become very expensive and it's just impossible to keep up with.
Fifth, looking at a global perspective, do you think people living in less developed nations can get the access to the healthcare that they need?
It's an interesting question because it's a big world, and so it varies significantly from one part of the world to the other. In the Western world, obviously, a number of the countries have very good health care. In some cases, some of the Western countries have better life expectancies than even in the United States. But if we look at the third world, they're still plagued with a lot of the diseases and a lot of the problems and challenges that they've had all through history. There are really just a handful of things that could make a significant difference and do make a significant difference when they can be applied. For example, probably the number one thing we can do globally to positively impact health is clean water. Now that's pretty basic, and we've known about that for some time. Another one, malaria. Malaria is still a big problem, a big disease that kills an awful lot of people. And if we can get out ahead of that can make a big difference. Malnutrition, simply not having the food and the nutrition that we take for granted in the United States can make a big difference globally. One of the biggest challenges, however, with that tends to be it's difficult, particularly in third world countries, particularly where there are dictatorships, where they aren't free. There tends to be more corruption, and where there's corruption, a lot of times the medical supplies, the food, and the other aid that we give doesn't actually get to the people that we need. So to the extent that countries develop and grow their economies, and to the extent that they become more free, we can have a material and significant impact worldwide on healthcare. And a lot of it is just going back to the basics, clean water, good nutrition, and so forth. And then down the road, there's more promise and there's more opportunity because of things like technology. So telehealth is the ability to extend out to the far reaches of the world healthcare and to provide consults to people in other parts of the world, and to really extend the healthcare that we have in the more developed countries out to the third world. So there's a lot of promise because of technology, and because the world is getting smaller, but a lot of it is hampered by the actual nations that we're trying to get into. If we can overcome that, then it'll go a long way. It's a long, big problem, and there's no easy solution. Kind of like healthcare across the board, there is no one solution. It's a big challenge.
Okay, well, that's all the questions, so thank you so much.
Great. Well, thank you very much. I appreciate your interest and appreciate it in healthcare. It's a big challenge. It's one of the biggest challenges that we have in this country, and we really need people to think about this and to really look forward and say, what do we need to do? What's the part I can play? And if nothing else, just taking care of one's own health. Getting enough exercise, eating well, being smart, taking care of yourself will pay big dividends down the road. And if we can do that as a whole country, we can all materially contribute to improved health for us and for our families. And so thank you for taking on this project. This is really important, and I appreciate your interest in improving and helping people live healthier lives.
Okay, thank you.
Thank you.